Hello everyone, this is you, a physical therapist. This time, I would like to introduce a paper on the theme of what is the appropriate amount of physical activity required for dialysis patients. Various studies have shown that physical activity is useful not only for healthy people but also for dialysis patients. However, I think there are many people who is wondering how much should they move actually. Let's learn about this question together. Let's start with introduction. Low physical activity assessed by questionnaire or accelerometer-based methods is strongly associated with poor prognosis in chronic kidney disease patients on hemodialysis, and evidence suggests that increasing of physical activity among dialysis patients improves performance-based outcomes. But it is unclear whether how much physical activity hemodialysis patients need in their daily living. So, the purpose of this study was to detect the minimum level of habitual physical activity to help inform interventions aimed at improving in the dialysis population. Next, disease methods. Clinically stable outpatients in a hemodialysis unit from 2002 to 2014 were assessed to be included in the study. However, patients were excluded who were as shown on the slide, who had been hospitalized recently months before the study, who suffered from a recent myocardial infarction or angina pectoris, who had uncontrolled cardiac arrhythmias, and so on. Habitual physical activity was measured using an accelerometer. Patients were instructed to wear it continuously during their waking hours for 7 days and to avoid getting it wet, such as during bathing. This table shows the characteristics of all patients and divided into three groups which depend on number of steps on non-dialysis day. Participants had a mean age of 65 years. 50.4% of patients were 65 years or older. Average time on hemodialysis was 7.0 years at baseline. The most common underlying kidney disease in these patients was glomerulonephritis, cystic kidney disease. Average number of steps on non-dialysis day was 4,337 steps. Patients were divided into two groups, survivors and non-survivors in this table. A total of 56 deaths occurred over a median follow-up of 56 months. Non-survivors were older and had low dry weight, low BMI, and low geriatric nutritional risk index. There was no significant difference in time on hemodialysis between the two groups. Non-survivors had a greater prevalence of atherosclerotic heart disease and congestive heart failure and had a greater comorbidity score. They also had a lower number of steps. The cut-off barrier for the number of steps discriminating those at high risk of mortality based on the urine index was 3,752 steps per non-dialysis day. In this figure, patients divided into two groups according to number of steps. The 7-year calculated survival rate were 87% in the group of above the 4,000 steps and 60% in less than the 4,000 steps. In Kaplan-Meier analysis, patients with physical activity above the 4,000 steps at baseline had significantly better survival than those with lower values. The hazard ratio in the group of less than 4,000 steps of physical activity was 2.37 compared with that in the group of above 4,000 steps. The hazard ratio of physical activity increased per 1,000 steps per non-dialysis day was 0.84. Now, let's talk about discussion. Some guidelines recommended that kidney health providers regularly encourage patients with kidney disease to undertake regular physical activity, and ACSM previously reported 4,000 steps per day as an activity goal for elderly, and other previous studies also reported same activity goals. Some reviews concluded that goal setting of physical activity is one of the most important key enablers to enhance and sustain physical activity for elderly populations. In addition to the technique of activity goal settings, wearing pedometer, using a step diary, and feedback from medical staff were associated with significant increases in physical activity, a magnitude of approximately 2,000 to 2,500 steps per day in community-dwelling people. This is the last slide. This is the first long-term cohort study of hemodialysis patients investigating a simple and suitable recommendation of physical activity for hemodialysis patients in the clinical setting. And this study supports 4,000 steps per non-dialysis day as an initial minimum recommendation of physical activity level for hemodialysis patients. Thanks for watching. There are many information that I haven't talked about in this research. I recommend you to read it if you are interested in. I'm waiting for your comments. See you in the next video.